Hi, it's Sandy Wiley. Welcome to my mental health channel, where I wipe away the stigma of mental illness by talking about my own personal struggles, having borderline personality disorder. I talk about complex post-traumatic stress disorder, anxiety, depression. I talk about narcissism and schizophrenia, and I wrote a book, Life with My Schizophrenic Father, a memoir of my childhood growing up, having borderline personality disorder, living with a narcissistic mother, and what it was like with a schizophrenic father. I also talk about all the unethical psychologists I've had sexual relationships with, and the therapies I've been in, and a plethora of other mental health related topics. But I only come on as a former patient of almost 20 years. I am not a licensed therapist, nor do I hold a degree in psychology, so I cannot diagnose you or give you a professional opinion. And all I ask in turn of you is your kindness and respect in the comments. Now, if you are new to my channel, welcome, welcome. Please hit that subscribe button in the lower right-hand corner. That way you will be notified each and every time a new video of mine comes out. Give it a thumbs up. Please share my videos on your social media platforms with your friends and your family. I want to hear from you. Please comment back on these videos. Tell me your thoughts, your opinions. They matter to me, and I will always respond to everyone's opinion. Everyone's comment, that is. I will always comment back. Now, today I'm going to debunk some of the mental health myths, all right? Mental health myths versus facts is what today's video is going to be about. Now, my whole channel is devoted to nothing but mental health. I have other things also included in that channel, but primarily it is about mental health. And that's what I've written all these books about too. By the way, the links to all of these books is down below in the description. All these books on mental health and poetry, my memoirs, are available on Amazon, and the links are in the description down below. So let's debunk these myths, all right? And let's talk about the facts of mental health, of mental illness. First of all, I want to start out with people who go to therapy are not crazy. There was a stigma. And this is what I want to, like in the beginning of every video, I say I want to wipe away the stigma of mental illness, because a lot of people are ashamed to tell anyone that they see a therapist. They want to hide it from their jobs. In fact, a lot of people don't pay out of pocket because they don't want it on their claims, on their insurance. They don't want any employee to ever find out their background check that they were seeing a psychologist or a psychiatrist. That's totally not true, okay? That's a myth that only crazy people seek therapy. People seek therapy for all kinds of reasons, you know. People go into analysis for years, like 5 times a week for 5 to 10 years, just to, you know, dig in deeper into their past. It's not people that are, you know, have severe mental illness like schizophrenia, or have personality disorders like narcissistic personality disorder, borderline personality disorder. It's not just people who have severe mental illness that go to therapy. People could go to therapy because they're going through a divorce, a difficult period in their life, or they lost a child or a parent, someone, or a spouse, and they're just trying to heal from that. It could be a plethora of other things that have nothing to do with that the person is crazy. Most people that go to therapy are very stable people. They have full-time jobs. They have careers. They're career people. A lot of people that go to therapy are doctors and lawyers. So let's just debunk that myth that only crazy people or people who have extreme personality disorders go to therapy. That's not true at all. Another myth that I want to debunk is that people with mental illness or personality disorders are criminals, violent and a threat to society. This is not true at all. My father had schizophrenia, and he was not violent to me. He never hurt me. He never raised his voice to me. He never yelled at me. He never swore at me. He never called me a name. He never, ever laid a hand on me at all. Never hit me. And he had severe paranoid schizophrenic. He was hospitalized many times. He had complete breakdowns, psychotic breakdowns, where he was hospitalized for weeks or months. So this is not true. I have borderline personality disorder. There's a lot of myths that, I self-harm. Borderlines, cut themselves, or they hurt other people. They're a threat to other people and themselves. Well, this is not true with me. I'm almost 60. I have never self-harmed myself, and I have never harmed anyone else. A lot of these movies, like Fatal Attraction, portray a person who has borderline personality disorder as some psychotic, crazy lunatic that, like in that movie. Watch that movie if you haven't watched that movie. It's a great movie that portrays borderline personality disorder in a very, very negative way. They make the woman, obsessed with the guy she had an affair with, who was married. She goes in the house and she takes their child's rabbit and puts it in boiling water. Yeah, so they come home and they see their pet bunny. Yeah. So they make that borderline personality like really disturbed and psychotic and like violent and criminal. Well, this is not true. I love bunnies. Okay? The worst thing I do to bunnies is eat them. Well, I've had rabbit meat. It's good. But it was already killed. And I love chocolate bunnies at Easter. But I'm only kidding you. I'm only teasing you. But so this myth, that's the second myth. This is not true. Another myth is that therapy will cure you. This is not true at all either. Therapy is to help you. You go to therapy to gain insights. People who think that they're going to go to a therapist's office and then be 100% cured, the therapist is some magician that's going to wave a magic wand, and after such amount of time, they're going to come out 100% cured. This is not the case. If you think that, then don't bother going to therapy, because you're going to be sadly mistaken. That's another myth, that the therapist can cure the patient, all right? The therapist is there to help the patient help themselves, just like a parent is with a child. A parent teaches a child to do things for themselves so they grow up independently and are able to take care of themselves. Well, a therapist does the same thing. They help the patient become well enough to function on their own without the need of the therapist. They're not going to cure you, okay? And neither is medication. Medication can hold your symptoms at bay, all right? My father, when he was on his medication, it held all of his hallucinations, the voices that he heard, that they stifled them. So they held the symptoms off, but they did not cure his schizophrenia, okay? So medication alone, medication is not a cure-all. You take a magic pill, mother's little helper and a helper on her way. Medication holds the symptoms off, but it does not cure it. So don't think that you're going to go to therapy, get some happy pill, take it, and boom, you're 100% better. That's not true at all. Now, another thing, people have different wrong ideas about mental illness. Like they think bipolar is, they think someone who's moody has bipolar. They think someone who is sad has depression. Or they think someone who is nervous, worried about passing a driver's test, or worried about going for a job interview, that person has anxiety. This is not true, okay? People can get sad and not be in a depression. People can be anxious and worried and not have an anxiety disorder. People can feel moody and not be bipolar. All right. So don't slap on your, armchair therapist. Don't slap on a diagnosis to someone because you see, they've been sad a few days. It's perfectly normal to be sad if something, like if you're going through a divorce. It doesn't mean you're in a depression. People don't understand what it's like to really be in a depression. I was in one where you don't want to get out of bed in the morning. You don't want to shower. You don't even want to brush your teeth. It hurts to brush your teeth. You have no hope. You have no happiness. All the things that made you happy before, you don't find happiness in anything. The things that you used to like to do, you no longer do. You no longer want to talk to someone. You just probably sleep. When I had the depression, I slept around the clock. People don't understand that depression is a clinical diagnosis. You just don't go around saying because someone is, sad and grieving a loss of a spouse, or, someone, you can't slap that down. You can't be an armchair therapist, okay? Same with bipolar, because someone is moody. Bipolar goes through extreme states of manic and depressive episodes where they can't sleep all night, like they're, they go through like wound up states of, mania, and then they come off of that. It's not like being a typical moody teenager. Anxiety disorder. Someone could be worried about a job interview or nervous about giving a speech. That's not an anxiety disorder. People who have anxiety disorders I have an anxiety disorder, go into extreme panic attacks where they can't breathe. They feel like their chest is caving in and their heart's racing and they're sweating like they're having a heart attack. They have pressure on their chest. They have to gasp for air. They feel dizzy. They feel like they're dying. It's not like a person who's just nervous or worried about something. They're excessively thinking in their head 24/7. They have insomnia. They can't sleep. Anxiety disorder. So don't say because people have these, think they're armchair therapists and slap on these labels to people because they see, oh, that person's worried. They must have an anxiety disorder. Oh, that person, is moody. They're bipolar. Or that person, is looking sad. They're in a depression. So don't label people. That's what I'm trying to say. It's not the same thing as, really being in depression, really having bipolar, really having an anxiety disorder. You have no idea unless you've had these diagnoses yourself and been through them. Another thing that people are misguided about, especially in the past, is that gay people or transgender people, all they need is to go to a therapist and they'll be cured of it. I don't know if people hold this thought now, but there's a lot of people who hold old, outdated thoughts, even in today's society, thinking that being gay or transgender is something to be cured, that it's a mental illness. All right, guess what, people? Being gay or transgender is not a mental illness. It's not something to be cured. Just because it doesn't, you don't go along with it, gay people can get married today, okay? But some people have that belief, that outdated belief that it's a mental illness and that it needs to be cured. People just have to go to a therapist and then they'll be cured of it. This is not true at all. Another myth is that people with mental illness had bad mothers growing up. They always want to blame us mothers for everything, all right? Not all people. Let me tell you something here. not all people who had bad parents, or particularly bad mothers, have mental illness. Okay? There's many people who grew up with bad parenting and don't have any mental illness. So don't go blaming the mother and say it's all my mother's fault or it's all my parents' fault that I'm this way, because that's simply not true. There are statistics to prove this. Like, all people that were exposed to trauma will have post-traumatic stress disorder. This is not true either, people. I just want to educate people, okay? And separate the facts from the myths. Because people who've gone through trauma, not all of them will have lingering effects. And post-traumatic stress disorder is very traumatic. I have it. So it's another thing I have. But that's not, it's not like one size fits all. Someone who has a trauma past will have a mental disorder or a personality disorder. That's not true. Or someone who's been through some trauma in their life will end up having post-traumatic stress disorder, PTSD. This is not true either. So I just want to make people aware of that. Another myth is that schizophrenics, like my dad, have multiple personality disorders. This is not true at all. I used to think this too. I thought that schizophrenia meant you had multiple personalities. It's not true, because you were delusional. You hear voices. Like if you read my book, this happened with my dad. But he did not have multiple personalities. It just meant he was psychotic. He was out of touch with reality, but he didn't have all different. Having multiple personalities is dissociative identity disorder. DID. Dissociative identity disorder. That's the multiple personality disorder. Schizophrenia is not multiple personality. All right, so I just want to separate that too. There's a lot of myths about borderline personality disorder, like I mentioned earlier in this video, that people think that people with my personality disorder are violent, or harm themselves and harm other people, and this is not true at all. So that's a few things that I wanted to clear up. That's only a few, but it's time that we bring this stuff out in the open, that we talk about it candidly, frankly, with each other. And please let me know your thoughts and your opinions. That you can disagree with me in the comments. I want to hear from you. And let me know what you think. All right. Until next time, have a great day and take care.